Thank you for watching the video. This is YouTube Medical University. This time we'll be talking about dangerous stools and introducing SOS signs from your body that you can tell from the color, shape and smell of your stool. Although we usually don't think much about our bowel movements, there can actually be warning signs from your internal organs hidden in them. There are lives that can be saved by paying attention to what you flush down the toilet. If you watch this video until the end, you'll learn how checking after using the toilet every day can help you detect changes in your body early and increase the chances of catching problems in time. In my actual outpatient practice, patients often ask me, "Doctor, my stools have been thin for a while now. Is this some kind of abnormality?" I've been asked that before. There are also many times when I wish they had told me sooner. So, in this session, I'll talk about what ideal stools are and how to deal with constipation. In part 2, I'll explain what your stool's smell says about your health. In part 3, I'll cover 4 dangerous stool types to watch for. At YouTube Medical University, we offer simple, reliable health info from a doctor's view to help you get healthier starting tomorrow. If you find this helpful, subscribe to the channel to catch new videos. Let's begin with the first session, ideal stools and managing constipation. When you hear the term ideal stool, what kind of stool comes to mind? The ideal frequency for bowel movements is once a day. Even if there's a gap, having a bowel movement once every 3 days is considered ideal. It's not only about how often you have bowel movements, the stool's water content and appearance also matter. There are ideal traits for these too. The ideal stool, medical professionals call this a banana-shaped stool resembling a banana. A long, smooth, single piece of stool. This is considered the ideal stool. Please take a look at this chart. It's called the Bristol Stool Scale, which is used by medical professionals. It's an indicator of ideal stool. The ideal stool is the 4th one from the top. It's a stool with moderate softness. Now that you know this, which number does your stool correspond to? Please let me know in the comments section. I've only ever had hard stools since I was born, so I thought that was normal. There are actually many people like that, but in fact, if your stool is hard, it can cause problems with your anus, lead to hemorrhoids, and even cause infections from there. You may end up having to go to the hospital regularly, and in fact, there are many serious complications as well. And in my practice, at least once a year I see cases where stool builds up too much, leading to constipation so severe that the person can't pass stool at all. In the end, the intestines can become blocked, and some people develop a condition called intestinal obstruction, where the food they eat comes back up through their mouth. Because of things like this, check the shape and moisture of your stool every day to monitor your health and see if you're getting enough fluids. Also, make sure your bowel movement frequency is appropriate. In the second half of this session, I'll share simple constipation prevention tips you can start using tomorrow. To prevent constipation, here is the first of 3 important things: staying hydrated. This is obvious, isn't it? For ideal, smooth. In order to have smooth bowel movements, water is essential. One thing to be careful about here is for coffee lovers, and, as is common among Japanese people, those who love green tea should be careful. Coffee and green tea have diuretic effects, so they're not suitable for hydration. The recommended way to hydrate is to drink a glass of water or warm water when you wake up in the morning. The reason is, when water or food enters the body after waking up, it stimulates bowel activity because it helps improve bowel movements. So the second tip for relieving constipation is to eat a proper breakfast and make sure to have 3 meals a day. Just drinking water when you wake up in the morning is not enough to relieve constipation. In such cases, please check if you are eating a proper breakfast. Breakfast is essential for setting your digestive rhythm for the day. If you're too busy and don't have time to eat, try to think of it as a way to prevent constipation and start by eating just a banana. You can also try something easy to eat, like yogurt or jelly. I recommend trying that approach. If you skip breakfast and then overeat at lunch, this can cause what's called a blood sugar spike, where your blood sugar rises rapidly, which can damage your arteries. It can also cause a sudden surge in insulin, putting extra strain on your body. I previously uploaded a breakfast video on YouTube, so if you're interested, check the description below after this. Here is the third tip for relieving constipation: exercise or massage. Have you ever heard that exercise is good for relieving constipation? It's said that by exercising, our bodies stimulate bowel movements, which helps prevent constipation. Alternating between exercise and rest, having that kind of rhythm in your activities stimulates the switch between the sympathetic and parasympathetic nervous systems, helping your bowels move properly when you want it to. This helps your body develop a good rhythm. Also, massage can be effective for some people. Our large intestine goes up against gravity from the left side, then moves across horizontally. Finally, it goes down on the left side of the body and is expelled as stool. So, by massaging your abdomen in a circular motion like this, you warm up your stomach, which promotes bowel movement and improves constipation. There are people like that as well. In order to develop the habit of being conscious of bowel movements, try doing this when you lie down before going to bed at night. Massaging your abdomen is recommended as a habit. In the past, I have explained about constipation in detail. There is a video about this, so if you're interested, please check it out from the description after this. Now, let's review Lesson 1. The ideal bowel movement is the fourth one from the top on the Bristol stool scale, which is the banana-shaped stool. For those whose stool is dry and cracked, for those who have stool that looks like small round rabbit droppings, or if your stool is too soft, please take measures against constipation. To prevent constipation, I introduced drinking enough fluids, having breakfast, exercising regularly, and massaging your abdomen. Next, in Lesson 2, we'll see if your stool smell reveals your physical condition. I'll share some interesting research on this. Have you ever noticed that your gas or stool smells worse than usual? There is some interesting research from Japan about this. Things like vegetable juice, fermented drinks, and oligosaccharides are thought to have a positive effect on your stool. They compared a group that consumed these foods and drinks with a group that did not. The group that consumed foods and drinks considered good for the gut, and the group that did not, compared to the other group, had an increase in daily stool volume, improved stool odor, and also experienced better sensations and less pain during bowel movements. Research results have shown that these aspects improved. Furthermore, not only that, but also the contents of the stool. Among the intestinal bacteria, Clostridium, which is considered a cause of enteritis, was found less in people who consumed foods said to be good for the gut. The group had significantly fewer of them according to the report. In other words, a gut-friendly diet not only improves the smell of your stool, but also increases stool volume and may help balance your gut bacteria. Red meats like pork and beef. And consuming too much processed meat, such as ham, bacon, and sausages, increases the risk of colorectal cancer. I've explained this in previous videos. When you eat only meat, have you ever noticed your stool becomes hard and difficult to pass? Or that your gas and stool smell worse? Haven't you had experiences like that? Based on the earlier report, this happens because of a meat-centered diet. It's possible that the smell of your stool gets worse, your gut bacteria change, and you become constipated, or your stool smells worse. So even though you usually don't think much about your bowel movements, if the smell or hardness is different from usual or getting worse, at times like that it could mean that the balance of your gut bacteria is off. If that's all it is, it's not too bad. But actually, suddenly, the color of your stool has changed, or it has suddenly become thinner. When things like that happen, it could be a sign of a health problem, so I'll explain more about that in the third period. But before that, let's review what we covered in the second period. You are consuming foods and drinks that are considered good for your gut, such as fermented beverages and oligosaccharides. The group experienced an increase in bowel movement volume, an improvement in odor, and also felt better during bowel movements. And research has reported that the intestinal bacteria that cause enteritis decreased. And we also introduced that excessive consumption of red meat and processed meat increases the risk of colon cancer and may cause constipation. Information about the risk of colon cancer and diets that may help lower that risk is introduced in this video, so if you're interested, please check out the video from the description below. Thankfully, this video has received a great response and has now been viewed over 4 million times. Thank you very much. Now then, thank you for waiting. In section 3, I'll discuss 4 dangerous stool types. When you have stools like these, I want you to go to the hospital. I'll carefully select and introduce these types of stools. The first of the 4 dangerous stools is this, thin stools. These thin stools, to get straight to the point, there is a possibility of colon cancer. For example, if colon cancer develops, it takes up space inside the colon. So when stool tries to pass through, it can't go through smoothly and comes out in a thin shape like this. Thin stools like this are more likely to occur in the latter part of the colon, such as the sigmoid colon, or in the rectum, which is close to the anus. The reason is that our large intestine absorbs nutrients from food, and the leftover waste comes to the large intestine, where the water contained in that waste is absorbed. In the first half of the large intestine, there is plenty of moisture, so even if there is colon cancer, the stool passes through softly and then it solidifies in the latter half and comes out as thick stool. However, in the latter half of the large intestine, the stool has already hardened, making it harder to pass, so it comes out in a thinner shape. It's easier to remember if you think about the large intestine's function. And the sigmoid colon and rectum are said to be the parts where colorectal cancer occurs most often, so you need to be careful. If you notice thin stools, you should also consider the possibility of colorectal cancer. However, please don't worry too much. If your stool is only occasionally thin, there's no need to be concerned. If your stool used to be thick but has recently become consistently thin and it's getting thinner and thinner, if it keeps getting worse over time like this, or if you can only pass thin stools all the time, in those cases you should consult your regular doctor or see a gastroenterologist. It could be a sign of colorectal cancer, and you also need to be careful about constipation. As the colon gradually becomes narrower like this, if hard stool gets stuck here, it will no longer be able to pass through. When this occurs, you can't pass stool, become constipated, your abdomen bloats, and you develop intestinal obstruction. Because your abdomen becomes bloated, you may experience abdominal pain, and sometimes the food you eat can come back up and you may vomit. In the worst case, surgery may be necessary. Don't think it's okay if your constipation continues for a little while. If you can't pass stool at all and your abdomen is becoming bloated, make sure to consult your regular doctor in such cases. Here is the second of the 4 dangerous types of stool. It's black stool. Among the types I'm introducing today, black stool is the most dangerous condition. If your situation matches what I'm about to explain, you need to consider going to the hospital immediately, even at night. That's because black stool often indicates a high possibility of bleeding from the esophagus, stomach, or duodenum. The esophagus, stomach, and duodenum make up the upper digestive tract where food passes first. If bleeding occurs in this upper part, the blood mixes with stomach acid. When blood mixes with stomach acid, it oxidizes and turns black. This black stool is called tarry stool. You know tar, like the paint or coating? It's that kind of black. This is called tarry stool. Because there is a possibility of bleeding, if you don't stop the bleeding immediately, it could be life-threatening, so this could be a highly urgent situation. If you damage your liver by drinking too much alcohol, veins called varices can swell up in your esophagus like lumps, and eventually they can rupture and cause bleeding. Things like stomach ulcers or duodenal ulcers can also be caused by Helicobacter pylori, stress, or smoking. And sometimes, taking too much of certain painkillers can cause these problems, or there could even be stomach cancer, which can bleed. Those things are also possible. As for methods of examination and treatment, the first thing is to perform an endoscopy. What's important to reduce the risk of this kind of bleeding is, it's to eradicate Helicobacter pylori, which is a risk factor for gastric ulcers, duodenal ulcers, and stomach cancer. I've uploaded videos in the past about stomach cancer and Helicobacter pylori, so please check them out from the video description if you're interested. Please note that it's not just slightly dark stools, but these pitch black stools are called tarry stools. And one thing to be aware of is that taking certain medications can cause your stools to turn black like this. The most well-known medication is iron supplements. The cause of anemia is a lack of blood. Some people become anemic because they don't have enough iron, which is a key component of blood, and for those people, iron supplements may be prescribed. When you take this medication, your stools will turn completely black, but that's a normal reaction, so there's no need to worry. There are also other reasons why the color of your stool might change. There are medications that can cause this, so if you are ever prescribed something, make sure to check with the pharmacist or doctor who gave you the prescription. The third type of dangerous stool is this one, whitish stool. As you can see in this image, it's whitish. It looks a bit yellowish, but it has a white tint to it. If you are having this kind of stool, you need to be careful. Let me ask everyone a question. Why is stool in the first place? Why is stool usually brown or yellowish in color? Actually, that's the color of bile produced in the liver. Bile is made in the liver. After that, it's stored in a sac called the gallbladder, which is along the pathway from the liver. And finally, it passes through a duct called the bile duct and acts as a digestive enzyme. It flows through our intestines. In other words, when stool becomes whitish, it means that this bile is not flowing into the intestines. There are several diseases that can cause this. For example, when the liver becomes damaged and can no longer produce bile. Hepatitis B, hepatitis C, and drug-induced hepatitis. Cirrhosis caused by alcohol. When bile can no longer be produced due to various causes, stool can become whitish. And in addition, gallstones can form in the gallbladder, and those stones can block the passageway. Because of that, bile flow can be blocked, causing the stool to become white. There is also the possibility of cancer. It could be bile duct cancer that forms in the bile duct passageway, or cancer of the duodenum. And then there's the pancreas. If cancer develops in the head of the pancreas, it can narrow the passageway, preventing bile from flowing into the intestines and causing pale stools. When a blockage like this occurs and bile can't flow into the intestines, the bile instead flows into the bloodstream. As a result, your urine may become dark yellow or orange, similar to the color of stool, and your skin may turn yellow, which is a condition called jaundice. A well-known sign is that the whites of your eyes turn yellow. If you notice your eyes becoming yellow like this, if your urine is darker than usual, or your stool is pale in color, it could mean that bile flow is blocked. If you notice any of these unusual changes, I recommend consulting your primary care doctor or a gastroenterologist. Finally, the fourth type of dangerous stool is red stool. This is called bloody stool. You've seen this diagram of the large intestine many times, but red stool often means bleeding from the large intestine. Bleeding from the earlier parts of the digestive tract, like the esophagus. If bleeding comes from the stomach, it reacts with stomach acid and turns black. If it's from the lower digestive tract, when bleeding occurs from the large intestine, you get red stool. The most frightening cause of bleeding is, of course, colon cancer. Cancer keeps creating new blood vessels to absorb nutrients from the surrounding cells, gathering more and more nutrients and growing rapidly. Because of this, cancer rapidly builds many new blood vessels in a rush, making them fragile and prone to rupture, which often leads to bleeding. Even among the patients who come to my clinic, some say, "Lately I get tired easily," or "I feel short of breath." When they come in like that, they often have anemia. In the end, we did a stool test called a fecal occult blood test to check if there was any blood in the stool. The test came back positive for blood. Then, when we performed a colonoscopy, it turned out to be colon cancer. As you can see, bleeding from colon cancer can sometimes be so minor that it can't be seen with the naked eye. That's why I strongly recommend getting a stool test every year as a screening for colon cancer. There are lives that can be saved by checking the stool you flush away. That's exactly what a stool test is for. Please consider it. I explained stool tests in detail in my video about colon cancer, so if you're interested, please watch it afterward. Also, when it comes to diseases that cause red stool, the most common one besides colon cancer is hemorrhoids. In the case of hemorrhoids, it's not so much that the stool itself is red, but rather that you might notice blood when you wipe or see the toilet water turn red. This is typical for people with hemorrhoids. Other causes include enteritis, ischemic colitis, where the blood vessels in the intestines become blocked, ulcerative colitis, which former Prime Minister Abe also had, and Crohn's disease, among others. There are various reasons why stool can become red. Bleeding is also a possible cause in these cases, so please try to visit a hospital and consult a doctor as soon as possible. Now let's review the third lesson. As for the 4 types of dangerous stools, the first is thin stools. I explained that this could be due to the passage in the colon becoming narrowed, possibly because of colon cancer. The second type is black stools. When you have tarry, pitch black stools, it could indicate bleeding from the esophagus, stomach, or duodenum, and this is the most urgent situation. However, it's also possible that medication is the cause, so it's important to check carefully. The third type is pale-colored stools. This happens when bile, which gives stool its yellow color, is not being produced or is blocked somewhere along the way. As a result, the stool doesn't have any color. In such cases, there could be issues with the liver, gallstones, or possibly cancer in the duodenum, pancreas, or bile ducts, so please pay close attention to the color of your stool and check if it appears pale. And fourth, I talked about red stool. Hemorrhoids are the most common cause, but it could also be due to colon cancer or a rare type of enteritis. Those possibilities exist as well. And slight bleeding that can't be seen just by looking is hard to notice. That's why I explained the importance of stool tests to prevent such issues from being overlooked. How was it? This time I talked about 4 types of dangerous stool. I discussed ideal stool appearance, ways to prevent constipation, what stool odor reveals about gut health, and signs that mean you should see a doctor. These were the topics I covered. Please let me know about the consistency of your stool, or if certain habits helped improve your constipation. If you had any abnormalities in your stool and went to the doctor, let me know what kind of illness it turned out to be. If you have any experiences, please share them in the comments section. Also, whether it's a thumbs up or a thumbs down, your feedback on this video will help me improve future videos. At YouTube Medical University, I share simple videos from a doctor's view to help you get healthier starting tomorrow, so subscribing would encourage me. See you in the next video. My first book is now published. As a general practitioner, my patients taught me how to stay youthful after 70. I want to follow their example as I never knew such methods existed. Thanks to the many patients I've met so far, I've gained a lot of insights. This book is filled with wisdom on how to live a healthy and happy life. Pre-orders are now available on Amazon. Special pre-order bonuses are available. See the description below. The book releases in bookstores nationwide on January 18. I'd appreciate it if you check it out.